Hi, I'm Sundae with Natural Sundae. Are you curious as to what neuromuscular massage is? Well, I can help. Now, the term neuromuscular massage means a massage dealing with the neurological system, and the muscles, the muscular system, neuromuscular massage. Now, neuromuscular massage is a very specialized form of massage that's performed by a therapist that's highly trained in the neurological system and its effects on the muscular system and the skeletal system. Neuromuscular therapy deals with trigger points. Now, trigger points are just that. They are points on the body that you can't see, but they are highly irritable and highly sensitive to touch. These points trigger pain in other places that seem to be totally unrelated. One example is the trapezius muscle, which is the most superficial back muscle, has a trigger point right here. And when it's activated, the path of pain, which is called the pain pathway, goes up through the back of the ear, up through the head, and down through the corner of the eye. So a trigger point is a point that triggers pain in another area. And there are many different causes for trigger points. Now, the first one is when a muscle has inadequate oxygen supply. And this is because there's not enough blood and nutrients getting to that muscle. Now, there are specific reasons for an inadequate circulation. Inadequate vitamin C, calcium, phosphorus, and iron. If you don't have enough of those vitamins and minerals in your body after exercise, your muscles will become stiff and not allow full and adequate blood flow to flow through those muscles. And what happens is when you don't have that blood flow, the lactic acid that builds up from stress and exercise and just daily life builds up. And it just builds and builds and builds and builds. And lactic acid makes your muscles sore. So when you have all that built up lactic acid, you have total soreness. So that's the first reason for a trigger point, for a very hypersensitive point on your body. The second reason is injury. Now, cartilage, bone, muscle, and fascia can also impinge or impede nerves. This is the second cause for a trigger point. There are also many other causes. I'll touch on one more before we have to go. Another one is poor posture or anxiety and depression. Usually when somebody's feeling down, their posture isn't the greatest and it's reflected in how they stand. Well, when your posture is distorted, no matter what the reason, your muscles and nerves suffer. So this is just a little bit about neuromuscular therapy and the trigger points involved. I'm Sundae with Natural Sundae. Take care.